All right. Hello, everyone. Thank you for joining us for today's Translational Science Seminar. My name is Kelsey Stoltzfus, and I have the pleasure of introducing our speaker for today, Dr. Deepa Sekhar. The title of her presentation is The Adolescent Health Network, the Value and Necessity of Adolescent Engagement in Research. Dr. Sekhar is a professor of pediatrics at the Penn State College of Medicine. She is a general pediatrician and a researcher with expertise in patient-centered health-related prevention interventions and community-engaged research. In January 2019, she became the executive director of Penn State Pro Wellness. She was previously funded by HRSA and PCORI on a project entitled Screening in High Schools to Identify, Evaluate, and Lower Depression, or SHIELD. SHIELD was composed of two distinct but complementary projects to evaluate the effectiveness of adolescent depression screening. These projects were heavily reliant on community-engaged research frameworks, including the active integration of stakeholder advisory boards that influenced the design, execution, and dissemination of this academic work. Dr. Sekhar has continued to leverage stakeholder input to support her project's success. She is a former CTSI CERC Fellow and now CERC Co-Lead. She recently completed a PCORI-funded engagement award to build a network of adolescent stakeholders, which she will share with us today. Thank you for joining us today, Dr. Sekhar.
Thanks for having me. So as Kelsey mentioned, the title of this talk is The Adolescent Health Network, the Value and Necessity of Adolescent Engagement in Research. And the project that I'm going to talk to you about was funded by a Patient-Centered Outcomes Research Institute Engagement Award. And I have the disclaimer statement there. Okay, so our goals for our next 30 minutes together are to make sure that you recognize the value and necessity of including the adolescent voice in research about teenagers, especially in the context of fostering diversity, equity, and inclusion in the research process. I am going to describe our PCORI-funded Adolescent Health Network, which is a freely available resource to launch adolescent engagement plans. And we'll have you maybe get the opportunity to think about how you might leverage the Adolescent Health Network in your own research work. So just to start off, wanted to provide a little bit of background about myself. I am a general pediatrician, and my entree into engagement and patient-centered outcomes research started back about 5 years ago. I was completing school physical forms and got to feeling like they were really just that. The Pennsylvania school physical forms ask about height and weight and body mass index, and you have to put in hearing test results. The kids need a dental clearance, but there is nothing on this form that asks whether students are in a good headspace to be successful in the school setting. Fast forward, and I wrote a proposal that was funded by PCORI and HRSA, as Kelsey mentioned in the introduction. And the study was entitled Screening in High Schools to Identify, Evaluate, and Lower Depression, or the SHIELD study. SHIELD was a randomized clinical trial comparing the effectiveness of school-based depression screening to the school's current process, which is student referral based on problematic behavior. We included close to 13,000 students from 14 Pennsylvania public high schools, had some amazing school partners throughout this, and in the end demonstrated that universal school-based screening was effective. Students were 6 times more likely to be identified with depression symptoms and twice as likely to initiate treatment. However, as you all know, if you've opened any piece of news in the past several years, depression is a controversial topic. And so in the context of running this randomized clinical trial, we were invested in making sure that we engaged with schools and communities throughout the time we were running the trial. And obviously, as part of this, we wanted adolescent perspectives, even on some of the logistics of the randomized clinical trial itself. So what do I mean by that? Like, what do they actually tell us? Well, when we went in to do the universal screening in schools, teens told us that they would be totally comfortable answering depression screening questions, but not if their best friend was peering over their shoulder in the seat next to them. So they told us to space the students out. And so that's what we did when we ran the trial. When we were screening at the schools, we made sure that the screening was done in a larger classroom or an auditorium where they could sit every other seat. Some of the students actually told us they would prefer nobody know about their screening results and they just get resources. Now, that was one request we could not comply with, especially as some of the questions on the screening tool asked about suicide risk. But again, it was interesting to hear their perspective. The other big thing they told us was that they would not routinely confide in their primary care doctor about depressive symptoms. They did not see the primary care office as a space to talk about mental health, which was eye-opening for me. You know, you're taught in medical school that you ask questions and people answer you, right? But that's not how it works with teenagers. And I will tell you that I myself have reworked the talk that I have with teens when I talk to them alone in response to some of the feedback from the adolescents. So, you know, I told you we got this feedback from the adolescents, but they were challenges with including adolescents on the advisory board for the study. And these were challenges faced by my incredibly well-resourced, well-equipped research team. Okay, so we had scheduling challenges. So while the professionals that we engaged with as stakeholders, so the parents and the teachers and the researchers wanted to meet during business hours, the teens could only meet after school got out. Or, you know, towards, you know, the end of the day, some of them had a flex or free period and we were able to do that. But there were many cases where adolescents on our advisory board, they participated in the context of a school club, actually, were like racing for the school bus towards the end of the meeting. There were issues with comprehension and context. So again, for the adult participants, you know, they needed different information and resources to be able to grasp the context of the study and the questions we were asking them. And the adolescents needed a little bit more in some cases, or needed the language modified so they would understand what we were talking about. And that was a challenge. Communicating with adolescents was challenging. It is challenging, right? For any of you that have a teenager, right? So, you know, most of us work by email, but teens don't always check their email regularly, especially when they are at school in terms of reminders and, you know, schedule changes. So that was a challenge. And then any of you who do any work with teenagers will know that they age out of participation. So you work with a group of stakeholders, you get them trained up and ready to go, but eventually they age out of the teenage perspective. So those are just a few of the challenges that we experienced in the context of the study. There are also some major benefits to engaging adolescents when you are doing adolescent health research. So the first, which you would think would be obvious, but I feel like a lot of researchers don't consider this. We don't think like teenagers. So while you might be a pediatrician like myself, or you might regularly work with teenagers, we really do not think like them. And what is important to us as adults who care for teenagers is very different in many cases to what is important to teens if you ask them to tell you what they would prioritize. How we explain a study and its outcomes is important, and making sure that we use language that teens understand and would appreciate is important, because if you're doing a study to improve teenage health and they don't understand the study and don't value the outcomes, they likely won't value your findings either, which means you've put a lot of time and effort into developing something that may not be used in the real world. So after our experience and challenges consistently and effectively engaging with teenagers in the context of that randomized clinical trial, the SHIELD trial, we wrote a follow-up PCORI engagement award. And the engagement award was really intended to build capacity among adolescent populations to engage with researchers. So what we did is we worked with a stakeholder advisory board of parents, teachers, researchers, and adolescents to build the Adolescent Health Network and establish policies and procedures for the network. So this is kind of vague and abstract. But what I'm talking about is a network that runs through schools. So a lot of my research work is through schools. And what we built was a network through schools. It almost functions like a school club or STEM or career enrichment activity from the perspective of the teenagers and the schools. Parents provide permission, but then the teens are free to sign up for sessions with researchers on their own. The sessions are done by Zoom. And then researchers can access the network when they have research questions or dilemmas that they need advice from adolescents on. Our stakeholder advisory board provided us a whole bunch of advice as we built this network. And so adolescents advised on what type of training they would need to understand the difference between being a stakeholder or partner on a project versus a research subject. They talked us through things like what kind of compensation would be reasonable to offer. Our parents on the advisory board reviewed the parent permission form. The school staff reviewed the memorandum of understanding with the schools. The group advised us on the number of sessions that should be required for participating adolescents in the course of a school year, evaluation form. They helped us with troubleshooting as we launched the project. And this is kind of what it looks like. So Penn State Pro Wellness, which is my research group, essentially serves as the broker between schools and researchers. We have a network of schools, and within those schools, there's students. So the students are signing up almost like they're participating in a club. There's a school advisor that is our contact person. The students complete a stakeholder training, which is called the Fireworks training, which is an online training for teens on being a partner or a stakeholder in research studies. And once they've been trained, they can sign up for sessions. On the other end, researchers can request to utilize the network. They fill out a basic form with information on the project so the adolescents know what they're signing up for, and then that allows them to connect with each other. So how this works, and I'm just giving you some more of the logistics so you'll hopefully get a sense of what I'm talking about, is about 6 weeks before you want to have your session, you'd submit this inquiry form. So the inquiry form, asks you for your name, your project title, and then the most important thing in this is a little 200-word summary that gets posted for the students to sign up. So say you were designing a questionnaire to better understand adolescent sleep habits. You would say, I am a researcher looking for your feedback on a questionnaire I've designed to survey adolescents about their sleep. We ask folks to keep this really, really straightforward and simple. I found the more esoteric the language in the summary, the less likely the adolescents are to sign up for it. We do have training materials available to researchers who want to sign up for a session. We found that folks have varying degrees of comfort with community-engaged research and patient-centered outcomes research, so you can use them or not as you would like. And then a couple weeks before your scheduled session, we ask you to provide any prep work you want the adolescents to look at in advance of the session. So if you wanted them to look at your survey before they met to discuss it with you, you provide that to them. We ask that it be no more than 30 minutes of prep work for these adolescents because they, as you know, most teenagers are doing a million different things. We also provide a template for your sessions. You have 1 hour on Zoom with these teens, and it helps you structure your time with them. And this is literally what it looks like. So you are on a Zoom call with adolescents from high schools. And so these are 9th to 12th graders. They can be from high schools across the state. We currently have 12 active high schools on the project. There will be 1 school staff member on the call. So while the adolescents are participating as project partners or stakeholders and not research subjects, there are situations, because a lot of these topics are sensitive when it involves teen health. It's something sensitive or concerning could come up, and this way we have a pathway established to deal with those concerns. You would spend the first few minutes on introductions, introducing yourselves. The adolescents would go around and introduce themselves and say what high school they're from, what grade they're from. We do strongly encourage them to participate with the camera on. The discussion is richer that way, that there are situations where they are unable to do so, and that's okay. You'll give a quick summary of your project, and then you spend the bulk of your hour getting feedback on whatever it is that you wanted help with. And then we say at the very end, if you have some extra time left over, you can open it up for questions from the teens, and they might ask what you hope to do with the information they've provided. In some cases, they ask about your career path and how you got to where you are. So I've given you a lot of kind of information on how the network runs. But I was going to pause a couple slides and talk about where somebody might realistically include adolescent input in their research work. So you could start all the way from the very beginning as you are picking your study question. Very simply, like, is this a topic or an issue that is important to adolescents? Is it important only to certain subgroups of adolescents? And what subgroups would those be? And how do I find them, right? These are all questions that our adolescents could answer. We get a lot of queries regarding recruitment. So folks often want to know how they can better explain their study to attract adolescents to participate. What participation requirements are reasonable? Are they asking for too many visits or too many blood draws? Like, what would be reasonable? Are there certain incentives that would be really appealing to teenagers? And again, these are questions that our adolescents are very well poised to answer. In terms of study results, even in the planning phase, you can start to think about, what your study outcome is going to be. And is this something that adolescents understand, something they could explain to their peers? And if not, can adolescents tell you an outcome that they would find valuable in the context of your study? And is that something that you could gather along with the outcomes data that you're already planning to get? In terms of dissemination, you might ask teens where, how, and when findings should be shared. They can give you advice on the wording you're using to disseminate your study results. And then thinking even more broadly, I know that, I'm a pediatrician, but many of you are not, or you're doing research with adult populations. Is there the opportunity? Because again, there's so much research among adults that gets sort of extrapolated to teenagers. So like a big one for the longest time was in SSRIs or depression medication. We would extrapolate dosages and effectiveness based on the adult studies to teenagers. For those of you that do adult research, is there the opportunity to think about, could adolescents give you input on expanding your research to include teenage populations? So with that bit in terms of what you might use the network for, going back to some of our logistics, after you've had a session with our teens, you get 48 hours later an audio recording of the Zoom session. We've heard from folks that they use this to variable degrees. Some are happy with just the opportunity to, in real time, get the feedback from the adolescents. Others did refer back to the recording. We will send teens and researchers alike an evaluation 48 hours after the session. And then for researchers only, they are asked to complete an evaluation 2 months after the session. One of our key pieces is getting back to the adolescents regarding how their feedback was actually used to inform the research work. So then our goals were to, easily connect researchers with adolescents to improve the transfer of feedback, to increase the adolescent voice in research about them, and to improve the quality of the research. That was really the goal of our engagement award program. And so this project wrapped up in June of this year. We are actually still running the Adolescent Health Network, and I'll come to that in a minute. But I thought it might be fun to share some of our results with you. So we had 58 adolescents that were initially nominated for participation by advisors at their various schools. 53% completed the formal enrollment, meaning they got the parent permission signed and they completed all of their online training activities. 10 students ultimately discontinued participation. The bulk of them were from one school that discontinued participation. So again, we were doing a lot of this in the post-pandemic world. And for this one school in particular, they were just totally overwhelmed and couldn't take on any new programming. We ultimately had 43 students from 12 schools that finished the program with us in May of 2023 when we conducted our final evaluation. Our student demographics are below, so mostly female, 65% white, 86% non-Hispanic. We ran a total over an 18-month period of 22 sessions of the Adolescent Health Network. 22 sessions were requested. We ran 21 sessions. One health researcher actually failed to schedule a session date. And so that was really exciting because you will also have to account for the fact that, the program doesn't run over the summer. So, we did pack in a fair number of sessions during that 18-month period when school was in session. They were 16 unique health researchers from 8 different academic institutions that made use of the network. There are a fewer number of health researchers than sessions, as 3 of the health researchers actually requested multiple sessions. So they made changes to their work and actually came back to us a second time requesting to use the network again for feedback. So that was really exciting as well. And so in terms of the post-session feedback, we had 76 post-session adolescent surveys across the 21 different sessions we ran. The response rate was close to 60%. We had 14 school advisors. They also complete, I didn't mention this earlier, a post-session survey. And again, the response rate was pretty good at 67%. So key things, nearly all of them, adolescents and school advisors alike, felt the health researchers used easily understandable language. And this was important because if you're going to talk to adolescents about your research work and get their feedback, they need to be able to understand what you're talking about. The majority felt the discussion was comfortable. I thought it was pretty neat. More adolescents were comfortable than school advisors. We did, as I mentioned, have some pretty sensitive topics. One of them that I can think of related to dating violence and intimate partner violence, and the students, from what I understand from that session, handled it really well. Health researchers also completed this 48-hour post-session survey, 86% of them. They all agreed, for those that filled out the survey, that the student feedback was helpful and the meeting format was appropriate for their research topic. And then, as I mentioned, we went back to those researchers 2 months later to get their feedback on what they did with the student input, and had a lower response rate here, 52%. 100% of respondents that would recommend using the Adolescent Health Network to a colleague. 82% had modified their work based on the student feedback, with the other 2 indicating they would do so in the next 6 months. And then over half had already applied for funding for the project. And one thing I didn't mention to you is the student comments can and have been used by health researchers to justify methodology in a grant application. We adjusted wording here. We used this recruitment strategy based on adolescent feedback, which I think is more powerful than just saying, I just decided to do it because I wanted to do it this way. In terms of final evaluation results, just a couple key elements. Adolescents, for the most part, felt that they were able to represent a youth perspective while providing feedback to health researchers. And then you can see that there was some interest sparked in a research career by participating in the program, which was one of the pieces I hoped would come out of this. I also hope that we are potentially building more aware scientific consumers of the literature, especially because we know after the pandemic, there is so much misinformation that's out there. In terms of just next steps with the Adolescent Health Network, I did submit a manuscript on the program to the CTSI's journal and hoping to hear back about that. We are looking to continue funding the project. I, as of July 1, took over as co-lead of the CTSI Community Engaged Research Corps. And as this is a unique angle on community engagement with a population that I have hopefully managed to convince you really is underrepresented, but worthwhile bringing into the fold in your research work, and hopeful we'll be able to continue to support it. We are still running the project. We have several sessions scheduled for this fall, and I've actively been meeting with folks who are interested in utilizing the network. One of our other goals is to increase the diversity of adolescents involved. So I kind of glossed over, and maybe you caught quickly, the demographics. They are mostly females who are participating, like 72%. And about 30-something% of the teens do not identify as white, but we'd love to get a broader scope of adolescents involved. As with any new program, especially something that's pitched from the school perspective as like a STEM or career enrichment activity, I feel like the first students to come to the table are those like go-getters, right? Like the students who are doing everything. We asked the teens in one of our final sessions where we got some feedback on the program, what they might suggest in terms of bringing some of their more reticent peers to the table. And one of the students suggested like a bring a friend session where maybe they wouldn't have to do all the training, but they could come for one session and just see what it's like to be part of the Adolescent Health Network, which I thought was a neat idea that I'm hopeful we'll be able to employ down the line. So if anything I've told you has you excited and thinking about stuff and you want to potentially use the network, please feel free to reach out. You can click on the link or scan the QR code. You are more than welcome to reach out to me directly if you have questions or if you're not exactly sure how you might use the network yourself and would like to talk through some of that. I'd be more than happy to brainstorm with you. And I'll kind of pause there and give anyone the opportunity to ask questions or have a little bit more of a discussion. Thank you so much.
Thank you, Deepa, for that phenomenal presentation. Coming from a background in project management, I can see how this is applicable to a lot of research projects once you know about it, that researchers can tap into this resource. So I encourage anyone with a question to either take your camera off, come off mute, or enter the questions in chat if you're more comfortable with that.
Hi, Kesley, how are you? Good morning.
Good.
Yeah, thank you for the presentation and this kind of work, especially engaging with the community. So I think you mentioned about the challenges you guys encountering forming those network, but can you just a little talk about like in more in depth specific challenges when you're establishing the network? And my other question is, I know you mentioned about this network is now existing. So maybe that this is something that's we as faculty, we can utilize this network for other purpose. I mean, to work with the program adolescents, specific health issues.
Yeah, so absolutely. So challenges in building the network. So I have to say, building the network itself was actually, it actually went very well. So because we were approaching the schools and pitching this as like a club or, opportunity for their students to get exposure to health-related careers and research, the schools were really actually pretty excited about working with us on it. We had to meet with several different schools to kind of explain to them what it was and what the ask would be of them. So in many cases, the school staff member who was going to be the point person wanted to know like exactly what was being asked of them time-wise in terms of committing to the project. But after we got them signed up and participating, I feel like the rest was pretty streamlined. The students are responsible for signing up themselves on Sign Up Genius. If any of you have kids, you may be familiar with this program. A lot of schools use it. So, after they're oriented, there's not a whole lot that the advisor has to do other than sign up for a couple sessions themselves because we like one school staff member on the call. So actually, the teenagers were eager. We got feedback from some of them that they were a little bit nervous their first session, like weren't exactly sure what to expect. But once they got into it, they were fine. And many of them were very excited that a researcher was interested in what they had to say. And I think the other piece of your question related to using the network, yes, we're up running. We are posting sessions. I spoke to somebody yesterday, have to speak to somebody tomorrow. So yes, if you're interested or have a project that could benefit from some adolescent feedback, we'd love to have you.
Thank you.
Hi, Dr. Sekhar. I really enjoyed your talk here, and something that I'm curious about hearing more about is what were some of the adolescent perspectives on being consumers of research? So once we have results, was there anything interesting or unique that they had shared about how they want to digest those those results or the meaning of those results in a way that's more relatable to them. Because I'm assuming that, hearing, oh, this was published in, X, Y, and Z journal, it means something a lot different to a teenager than it does to a researcher.
Yeah, so the feedback on hearing the results back would have been project specific. So that would have been an investigator in their individual session asking the teens how they would want these results back. So I don't know that I have that so much. When we sent out that 2-month survey, we asked the researchers to describe what they did with the results, and many of them hadn't gotten to the publication phase because a lot of this was informing study design. So they might say, we submitted a grant, or like we revised our survey questions based on the adolescent feedback. So I don't know that they were communicating actual study results so much as letting the adolescents know how the study itself was adjusted based on their feedback.
Awesome. Thank you.
Yeah. I see a question in the chat here about strategies for recruiting a diverse group of students and reaching at-risk youth. So, Carrie, I think I touched on this slightly. When we approached the schools initially, the school advisor was the one who recruited students. So the school advisor was the one who put it out to students. In some cases, the school advisor, I am pretty sure, identified certain students that they thought would be interested. So it definitely wasn't like in all schools it went out to the entire student body. I think what we'd like to do is pilot this bring a friend idea. And then in terms of recruiting a broader scope of youth, go back to some of these schools and see if there are other opportunities to engage students who might not initially be interested in participating. The other tricky part, so I didn't tell you all of this, but we were advised by the stakeholder board that it would be reasonable to expect students to sign up for 5 to 6 sessions in the course of an academic year to be kind of considered members in good standing. And I touched on compensation, but didn't tell you what the teens told me. So they did not want any monetary compensation. What they're looking for is like a letter of recommendation that can be included with a college application, or like being like a reference for like a job, because if you're going to work right after high school, it's hard to find job references. So sort of certifying that they showed up on time and participated. So, to meet, if you have like 50 students and you have to give them enough opportunities, right, to sign up for 5 to 6 sessions a piece, you have to run a fair number of sessions during the course of an academic year. So one of our rate limiting factors was having enough researcher sessions scheduled for the number of students we have. So we actually paused student recruitment at one point in time because we needed to make sure we were able to offer the existing pool of students enough sessions available to them that they, felt like they were getting good opportunity out of the program.
And maybe there is no other question. I think you kind of touch on the challenges with the diversifying the participant. I think that's good to it's not always having those students who come on the front, but I think you mentioned about the discontinuation of some of the students from the initial enrollment. Do you guys know why that's happened? The other one is, I think you also mentioned about the response rate. I think it's 59% on the feedback. And I think to me, it looks like it's a low. So do you guys, try to know why? I mean, is this because maybe the students, I don't know, thank you. You can.
Yeah. So discontinuing participation. So a couple of them graduated. A couple of them said, so we ran it over 18 months, right? So it started in like January of 22 and went to June of 23 is when it was active, like first launched with the PCORI funding. And so some of them graduated, some of them said they didn't have time. And then the bulk of them were from this one school where the school advisor said they didn't have time to be advisor for the program anymore and like pulled the students out with themselves when they excused themselves. So that was the discontinuation. As far as the response rate, so I touched on this in terms of challenges, right? Like, and this was something our stakeholder advisory board did to help with too. So getting some of these adolescents to open their email is a challenge, right? Like adolescents don't necessarily communicate by email. We actually set up a text reminder system to remind them when the session was going to start, because we had some issues with session no-shows for a while, which we overcame. But the evaluations go out by email and not by text message. So it's possible they just don't check and then don't respond. Like we get a lot of that. And I don't know, we didn't spend a ton of time on this because it was our first time doing the final evaluation and kind of going through stuff at the end of the PCORI award. There are ways that we could probably work around this, right? So do you end the session 2 or 3 minutes early and give the students 2 minutes to fill out the evaluation there before they hop off the Zoom call, right? Like that would probably solve it significantly if you just dropped the link in the chat and made sure they all responded before they hopped off.
Yeah, I think that's on the spot, you're right.
Yeah, I have some thoughts there too. If you're using their school email versus their personal email, and if it comes over summer, they don't have access to that school email anymore. So the timing of the evaluations, if it's like those 2-month follow-up ones.
Yeah, so we ran into all of this. So things you should know, the same way the Penn State email server blocks things, so school email servers block all kinds of external emails. So one of our issues early on was that the students, we actually make them enter a personal email because the school server seems to block a lot of emails. We ran into stuff initially where the school advisor was the touch point. So then in some cases, the school advisor wanted us to email them when we had a new session open up, but then we were relying on that person to then disseminate to the students. So there was like a time lag there. So we kind of, again, worked around that by asking the students to provide a personal email separate of the school email address. So we could let them know immediately when a new session was available and weren't getting blocked by the school email servers. But yeah, the school personal email thing is tricky. And then they don't check email when they're at school, right? Like they're not opening up their email account like an adult at work.
Yeah.
So that's another thing that, we learned.
I have a couple more questions as well, if that's
Yes.
okay. So the first question for the school advisor, was that person like a nurse, a health educator? Did they have a health background, or it could be anybody?
No. So usually not a health background. It was often a counselor. And sometimes some schools have like a career counselor person or career counselor role. So it would be that individual. We also reached out to like science teachers because again, it was, STEM related and the opportunity for students to see science applied in real life versus what they were learning in the classroom.
So then if an issue came up during the call that the advisor needed to handle that, they just had the appropriate resources to refer their student to?
Yeah, so basically it would be like, I don't know, you're talking about like intimate partner violence, and a student in the context of answering something sort of leaves it open that maybe something happened to them, right? Like we wanted a school advisor present on the call. That the advisor might not necessarily be present from that school. What we would realistically do is reach out to the advisor at that school, right? If there was any additional information that was needed, like sometimes it's nicer to talk to a peer. So we thought, this teacher would be able to talk to the teacher at the other school who was on the call to be like, what was said. We also have the audio recording, and then it could be reported through the standard school channels. It didn't happen. We just wanted to be prepared in case something did.
Yeah, understood. And then my second question was, do you have a map of where schools were located across the state, and then also a map of where the researchers were located?
No, but that wouldn't be a bad thing to pull together. We could definitely do that. We don't currently.
I'd be interested to see your rural urban distribution for both of those.
Yeah, I'm actually not sure. Thank you, Kelsey. We can do that easily.
Awesome.
Yeah.
I have a couple follow-up questions. Did you count training? Like, I'm interested in the sessions because I think we would have a similar problem that we wouldn't have enough research sessions. But we also have community partners who are hungry for the feedback of youth. Did you ever have, or do you think it could work if community partners were also, following the same system where they put in a ticket kind of for maybe a program or a service they want feedback on?
So Carrie, is so funny because I just got off a call about this same thing. So we actually run, like Penn State Pro Wellness, in addition to running this project, runs a youth advisory council for the state of Pennsylvania. We have tried to be very deliberate about triaging research-related requests to the Adolescent Health Network, and that is primarily meeting with a research professional. Whereas if they're community members or like organizations looking for programmatic input, to triage them to Youth Advisory Council, because those students don't have the same stakeholder partner training as the
Okay.
Adolescent Health Network teenagers.
Okay. So you're blessed with an abundance of youth feedback. Yeah, that's awesome.
So like maybe this is a follow-up to Kesley's question about the school. So how do you guys select these specific schools? Is there any selection criteria due to proximity? I don't know. Are there any?
So Pro Wellness runs a program called Healthy Champions. It's been around for many years now. It is a lighter touched web-based program that we help with school wellness initiatives. There's a champion at the school, but basically we are connected with schools through that. There's a newsletter that goes out. So that was some of the way we advertised. Like, we reached out to these schools and said, hey, we're launching this new program if you're interested. Some of the folks on the stakeholder advisory board like roped in. So we had school representatives, we had parent representation, like they looped in their schools, right? And so we were able to get additional schools that way. So in this case, it really was a first come, first serve, right? Like, because we were rolling out a new program and we were just like, we need to get folks in the door. So yeah, I don't know that I would be more selective down the line so much as I mentioned, I think our rate limiting step is the researchers, right? Like, I have to make sure that I have enough, if we recruit more teens, that they feel like they have enough availability of sessions.
Any final questions or comments from the group? No? Well, if you do, feel free to reach out to Dr. Sekhar, as she said. She's more than happy to chat. And then you have the RedCap link to request access to the AHN as well. Follow-up slides and the recording will be distributed after this, so everyone will have access to everything there. Anything else to add, Deepa?
Nope.
Wonderful.
Thank you so much.
Yeah, thank you all for coming today. Have a great rest of your day.
Yeah.